Hi guys, I'm Balrik, and I thought it would be useful today to talk to you about how to start preparing for the clinical station. So first of all, why? The clinical station, I think, is one of the most important stations. It often is the differentiator between getting the job or getting the job in the area that you want or not. And I think with scores kind of increasing over the past 2 or 3 years, I think now where you were getting 3s and 4s, I think you especially need 4s and 5s. So I think a 5 out of 5, and I think you've got a very strong chance of, and those candidates we often see getting the jobs that they want. I think if you're getting 4 out of 5 in the clinical station, all bets are on. I think you've still got a good chance. I think if you're getting 3 out of 5, those candidates, unfortunately, the ones that we see that really struggle to get a job or get a job in the area they want. So I think it's so important to prepare well for the clinical station and give yourself the best opportunity to score as high as possible. So really can't underestimate that. I think the first thing that you need to do for your specialty is have an idea of the topics in mind that are common and regularly come up, and have an idea for the uncommon topics that can also come up, and because this always does throw candidates, and that's what we try and do on the website and on the course, where we go through the common topics that come up, but also the uncommon topics, and try and give you a comprehensive rundown on these. So I think really important to first of all have those topics and get that list of topics in your head. So the cannot miss points are the kind of points that you need to be talking about and ready to talk about, and if you fail to mention these things, you're going to struggle to get more than a 3 or 4 out of 5. So examples of this include, if you're talking about managing a COPD patient, knowing your thresholds for when to commence NIV. Another example is if you're in dermatology, if you're managing urticaria, knowing exactly the parameters that indicate steroid therapy. And if you're managing an inpatient with IBD, knowing when to involve the surgeons and when surgical intervention is appropriate. Those kind of things are things that you absolutely must know for each of the topics. We call them your cannot miss, and there's normally a few for each topic. Your 5-star level points are the kind of points that are not necessarily in the guidelines, are not necessarily hugely clinically based, but show the consultant sitting across from you that you really are ready to be a registrar in that specialty, and you've really taken the opportunity to immerse yourself or talk to lots of registrars. And these are things that we really emphasize and hammer home in the course, and you'll notice on the videos and the mock scenarios and the vignettes, these are ones that we really highlight, and I think these are the things that really score you those 5 out of 5 level points. And a few examples of those are, for example, for starting biological therapy, it's not just knowing what the screening tests are, but it's actually knowing how to organise them, when to organise them, and how to interpret the results. If you're taking your patient to the Cath lab in cardiology, it's knowing what subset of patients need to have defibrillator pads put on prior to going into the Cath labs, because they're at a high risk of going into VF and needing shocks during the procedure. So that's very important and very pragmatic. Another example is, if you've got a patient with an unknown cause of renal failure, not just knowing that renal biopsy may be indicated when it's indicated, but actually being able to talk through a renal biopsy to that patient, and also appreciating how the results get interpreted, where the results get interpreted, and what members of the MDT are there to discuss the results and come to an eventual diagnosis. That's a big part of that. And those are kind of things that you don't necessarily need to pick up in the books, but as registrars, you will definitely come across and be a big part of your day-to-day life. And it shows the panel sitting across from you that you really have thought about how to be a good registrar in this specialty. So the first one, hopefully, is something everyone's aware of, management DKA. So what are the 3 cannot miss points? So the first thing is you absolutely need to know the parameters. So you need to know how to interpret an ABG and blood test to differentiate between HHS and DKA. That's a core piece of knowledge. Second core piece of knowledge is you need to be able to talk about and consider when to use a fixed rate insulin infusion versus a variable rate insulin infusion, and when to switch between the two. And the final piece of core knowledge, I think, is not just knowing that hyperkalemia is a potential complication, but knowing when to test, how to test, and more importantly, how to correct it. These are all cannot miss points that you need to be mentioning to get you 3 or 4 out of 5. And then there are your extra level points. And these are things such as knowing when you need to get ITU involved, knowing when the patient absolutely needs ITU admission, ITU level of care, and appreciating what extra care and treatment your patient can receive on ITU or level 2 care. Another thing would be to consider what to do about patients short-acting, medium-acting, and long-term acting, long-acting insulin therapies, both whilst they're being treated with TK and actually as they come to the end of their treatment as well. And that's something that I think really stands you out as a candidate that's thought a bit more about this process. And another thing I think would be a 5-star level point is really thinking about the precipitants. Is this a patient that's developed euglycemic DKA because of recent commencements of SGLT2 inhibitors? Or is this a type 1 diabetic that fairly classically has not been compliant with their medications? And actually thinking about that early and involving the MDT to think about how you can make this patient more compliant and think about how you can not just treat this episode of DKA, but prevent further episodes of DKA. Again, really mark you out as a mature candidate that's not just very comfortable dealing with the acute situation, but thinking further to how to improve the overall care for these patients. And that's pragmatic points that I think really mark you out. Classic case is, what are the situations in which you take a patient with an NSTEMI to the Cath lab overnight? So I think the core piece of knowledge that cannot miss is to kind of appreciate the indications for Cath lab overnight in these patients. So you can break that down to hemodynamic, rhythmogenic, and other. So hemodynamic, you can talk about if they've got cardiogenic shock or pulmonary edema. Rhythmogenic is, for example, if they have difficult to control VT or heart block that needs revascularization. Other, if they have refractory chest pain or develop STEMI or STEMI equivalent ECG changes overnight. These are all indications Cath lab, and this is core knowledge that everyone should know if they're getting this kind of interview scenario. You also need to think about what are the 5-star level points if you're taking a patient to Cath lab overnight. I think the things to be aware of is if you're taking an emergency unwell patient to Cath lab overnight, this is a patient that should have pads on, defibrillator pads on, and so that you can really be ready to shock the patient out of VF or VT if they go into that mid-procedure. Secondly, a very aware candidate would have felt and documented the strength of the right radial pulse, so they know that this is a patient we're going to hopefully have quite straightforward access, or we need to think about left radial or groin access up front. And then thirdly, another very useful pragmatic piece of information is to ask the nursing staff before they go into the lab to make sure the groin is prepped, so that you have your bailout access ready should you need it in this emergency situation. And again, these are all 5-star level points that you're not necessarily going to come across in the books, but really do mark you out as someone who's thought a lot about their specialty, and a consultant would be very happy to have you as their registrar, because you're thinking not only about how to manage this patient here, but you also think about where this situation could go, and you're aware of that. I think if you can really think about the topics in your specialty that you need to cover, both the common and uncommon, and then think in terms of what are the cannot miss points, have at least 3 for each topic that you need to know at the back of your hand, and what are the 5-star level points that I need to pepper into this example to show the consultants that I am thinking at the level of a registrar that they would like to have working under them. So yeah, best of luck preparing, and let us know how it goes.